Right then, Ollie. It is episode 15, I think, and it is
Think.
self-care week.
Yes, it's
So,
all this week, isn't it? 17th to the 23rd, is that right?
yeah, which is, I suppose, it kind of absolutely speaks to kind of what really kind of fires us up to some degree, and probably is kind of how we've got to where we've got to is thinking a lot about self-care, self-management, all of those things. But I thought I'd look at the kind of the definition.
I can
So
start.
this it's a good place to start. So this is from the Self-Care Forum. I'm sure other definitions do also are available, but they say the actions that individuals take for themselves on behalf of and with others in
Mm,
order to develop, protect, maintain, and improve their health, well-being, or wellness. It's
nice.
always good, isn't it, to kind of start with a proper definition. I'm sure we could kind of come up with our own, and I'm sure other people listening will have their own as well. But I thought that was good.
Well,
Um,
you're right. It does fire us up, doesn't it? Because we've always been, I think it's GPs, haven't we? It's what got us into health coaches, and we've always been interested in what people to do to look after themselves. Because it just works better, doesn't it? If you're in the driving seat, was it Rangan Chatterjee says, be the architect of your own health and your own life, isn't it? Things tend to work out better. So we've always enjoyed thinking about how we can encourage people to do that. So self-care week is perfect for us, isn't it?
Yeah. And I know probably some of the drivers are, well, obviously, if people look after themselves, then that is cheaper. But we've always been minded to think, well, actually, do you know what? It's just the right thing to do, isn't it? That as far as possible, people look after themselves. It's better for them. It's definitely.
Absolutely.
So they kind of talk a little bit as well. I like this kind of, and again, it speaks to some of the work that we do, but they have this self-care continuum.
Mm,
So they have kind of pure medical care at one end of this spectrum, and then they have pure self-care at the other end of the spectrum, and all of these kind of steps in between. So an example of pure medical where you might need pure medical care might be kind of major trauma.
right.
Something like that, or a major kind of psychiatric episode. I suppose that's maybe where the medical care absolutely kicks in. And then all of these other steps, which is, maybe acute conditions, long-term conditions, minor ailments, self-managed conditions, lifestyle and prevention, and then the daily choices that we make at the very end of the spectrum. So I don't know, that's quite useful, I think, to kind of help us think about it. What do you think?
Yeah, no, definitely. I like that. I mean, when if you're having major trauma or a psychotic episode, probably self-care is a little bit less useful, isn't it? But I know we know, don't we, from a lot of research that actually most of what we do in primary care, certainly, and actually most of what happens to people in everyday life does not involve those emergency things. So self-care plays such an important role. And actually, you're hearing you talk about the continuum reminds me of that one of our favorite exercises. We sort of stumbled on it, really, didn't we? We call it the lineup exercise, don't we? Where actually we literally, particularly when we're in a room with people, but it also works online as well, is you literally get people to think about not when you're in an emergency situation, but in everything else, when you're looking after yourself, where does the optimum balance sit between what somebody else does for you, perhaps a medic or a service, and what you do for yourself, what you might call self-care? And we get people to sort of position themselves somewhere on that continuum, like you talk about, where they think the optimum balance sits between self-care and being cared for. And it's always really interesting what that shows up, isn't it?
Yeah, because often people tend to kind of put themselves towards the end of the person themselves. Because we ask them the question, so who makes the most important contribution to good outcomes, I suppose, in
Yeah.
healthcare? And people tend to move a little bit towards the kind of the person themselves, and that's that kind of 70-30 kind of split I think we often see.
Yeah.
And then we also then ask people, well, so what does it feel like now? Does it feel like people are taking more of the responsibility for their own health, or does it feel like their health and social care system is doing that? And often then people do move a little bit, don't they?
They do, and I mean, yeah, I think we must have done this thousands of times now, mustn't we? Literally with thousands of people. And I think I back up what you say. I think people vote with their feet, and generally the median is around about 70% self-care and 30% contribution from the system and from services. And actually that's backed up by research. There's been multiple trials over the years. The WHO, the Health Foundation, when organizations look at what is it that contributes to good health outcomes apart from the emergency stuff, what is it that contributes to good health outcomes? It often comes down about 70-30, where what you do yourself is probably 2 to 3 times as important than what someone can do for you. So there's clear evidence that self-care is really, really important, isn't it?
Yeah. So again, what is it then that people need in order to look after themselves, to kind of engage in that self-care? What would you say?
Well, I think my reflection is, and it came out sort of in that definition, didn't it? What you do for yourself or for other people. I think self-care is not a solo it's not a solo sport. Often there's a temptation to think that self-care is just about being selfish and putting you in the middle and looking after yourself. But I think it's a very unselfish thing to do to look after yourself. And often you're thinking about, well, who am I doing this for? I'm doing it maybe for me, but I'm doing it so that I've got more energy and I am more healthy so that perhaps I can contribute more to my family, can give more to my kids, more to my partner. People are often, really committed to their work, find it meaningful and important to them. So they want to have energy and health and vitality to be able to contribute well and perform well at work. Or it might be with friends socially or part of a sports team. So looking after yourself it can be very selfless. It's giving yourself more energy so you can contribute more to the people around you. So I would say that would be an initial thing for me.
Yeah, agree. And often what they talk about that for people, in order for people to do that, they also need knowledge as part of that. They do need to kind of some information about how they can best look after themselves. And there's lots of information out there. In fact, if people go to the self-care forum, there's lots of kind of resources that
Yeah.
people have. If people want to kind of look at those or have them in order to share with other people, that will be a good website. Selfcareforum.org will be a good website to go to. Um, I suppose the other thing I like about that, the concept of activation, which I know we talk about a lot, is that it's not just knowledge that people need. People need confidence and skills,
Yeah.
and that's probably why they need also other people to support them to build those confidence and skills.
I agree. Yeah, absolutely. And I think we've seen that. I've seen that loads in my practice, actually. I mean, obviously, that's kind of a main remit of a health coach, isn't it? To support someone to self-manage really well. And having someone there to kind of, help you work through what's going on, raise awareness of what your current situation really is, and maybe where you want to get to, who you want to have energy for, why you want to have energy, what's important to you, and helping you to make a plan and holding you accountable to that. So a health coach has a role there, but I also think peer support is really important. I've seen that time and time again that, people like you in a similar situation. So someone also recovering from mental health illness, someone living with diabetes, maybe they've managed to reverse their diabetes and put it in remission. Those sort of people can be really useful to help you to self-manage well. Partly because they might give you a little bit of knowledge, a little bit of insight, but more than that, they give you confidence and a sort of hope and can do that it's possible. And I think those are the things that really underpin people then developing their own skills and their own confidence to look after themselves. I don't know. What's your thoughts on that, Tim?
Yeah, well, we talk about that, don't we? I'm just trying to think about kind of our when we think about working with groups, and I remember that. Some one of our associates was saying, about the importance of community, and we kind of therefore added the C of community to kind of working well with groups. It
Yeah.
was Jane Raworth, and she said, yes, we do in order to kind of work well with people, you've got to connect with them, you've also got to contract, you've got to coach, but the fourth C is community. And if we want people to look after themselves and support other people to look after themselves, then we need to be thinking about that when we're starting to work with groups. We need to have that community. What is going to happen beyond this time that we're with them back in the community? Because that's where self-care sits, isn't it? It's not in hospitals, it's not in GP surgeries, really. It's out there in the community.
Yeah, no, I agree, absolutely. So it really self-care is not a solo pursuit. It's not selfish, and I think even more than that, we can all actively help each other to self-care, can't we? I think there's something that that almost it's about how we build how we normalize self-care, how we build an expectation that we're all going to try and do it. And I think for me, there's something about being kind to each other as well. We sort of hold each other to these targets. You must do this, you must exercise, you must eat well, you must stop smoking, you must do all these things. And sometimes, life's tough and just you fall off the wagon, don't you, or whatever. But there's something about being kind to each other and recognizing we're all a bit vulnerable and sometimes we're all a bit rubbish at looking after ourselves. But nevertheless, allowing people to get back on the horse again and allowing people to sort of, have a tough day, tough week, tough time, but actually then sort of, just think, come on, what do you need to sort of, regain a bit of control and get back on that horse again? I think there's something about creating conditions where it's okay to fail, but okay to start up again.
Yeah. Yeah, that's reminded me of that BJ Fogg's book, The Tiny Habits.
Oh yeah, you like that one, don't you?
Yeah, what I like about it is that he has this kind of formula about behavior change, which is motivation times ability times prompt. It's probably not a proper formula, but the point is that when people are really motivated, they can do some really hard stuff.
Mm,
All right. But when they are not motivated, but people's motivation goes up and down all the time, doesn't it? It's not like I am a motivated person. So
yeah, yeah,
people may not be motivated to kind of look after themselves or take any proactive steps in self-care for periods of time. Therefore, I suppose what he would encourage people to do is to do a small amount. So when you're not feeling motivated, what you need to do, it needs to be really, really easy to do it.
yeah,
So your
yeah,
ability to do it needs to be really, really high. And again, the P stands for prompt, So again, making sure that people maybe are prompting themselves or maybe prompting each other just
yeah.
to take care of themselves. Um, yeah.
Prompting. Yeah. Do you use any prompts in your life then, Tim, to help you to self-care? What works for you?
Yeah. Well, I mean, I my
Apart from me nagging you about whether or not you've looked after yourself or been for a
yeah.
run, whatever,
Well, I have a four-legged prompt every most workday mornings because I have a dog that kind of definitely is better when he's been run in the morning. So that's my prompt in the morning. And I suppose the other thing I've started to do, I think off the back of the kind of the tiny habits is to do things like, when the kettle's boiling, do some press ups. That's what I'll do.
Oh, right.
And again, I think I remember Campbell Murdoch's kind of 28-day plan. Again,
Yeah.
just small things that you can just make part of your routine. That 28-day challenge. I think those are kind of useful things, but it's almost like you have to have what they call it habit stacking. I think where you're
Habit
gonna
stacking.
stack a habit, a new healthy habit on top of something else that you would normally be doing. Does that make
Yeah,
sense?
yeah. Yeah, so you tie it in with something that you regularly do to, like, say you're boiling the kettle. I don't know, probably you're boiling it once every hour or so, Tim, aren't you? With the number of cups of tea you have. So you can use that time to associate with something that you want to change your habit of, isn't it? And I know BJ Fogg says, isn't he, that it takes a certain amount of time, doesn't it, before something becomes a new habit. And you then don't even have to think about it because it's just part of what you do. I remember when I was starting to ride an electric bike instead of driving the car, which actually works really nicely, especially in a city like Sheffield with lots of hills, because it really does help you to sort of like make it easier. Coming back to that ease bit of BJ Fogg's thing. But I remember after a couple of months, it felt really weird to even think about getting in the car. So for the first few weeks, it was a bit tough, and it was raining. I thought, well, maybe I'll take the car. But after I've been doing it for a couple of months, actually, it would have felt it. I did. The bike broke down, and I had to take the car to work one day, and it felt really weird getting in the car and thinking, what am I doing? This is not what I am. So yeah, once you've established the habit, it becomes easy, doesn't it?
Yeah, and it's important, isn't it, I think, to start small.
Yeah,
And
absolutely.
always have that kind of thing to kind of fall back to because life does get in the way there's no point just going, well, if I can't do my half an hour run, I'm not going to do anything.
Yeah,
Whereas if you can't do your half an hour run or you can't do your 30-minute walk or whatever it is, then it's like you can do some sit to stand or you can do something
yeah.
in that time or you can do some meditation. I think you're a fan of meditation as well, aren't you, Ollie?
Yeah, I am now. It took me a long time to get there, though. Actually, it's quite a good example of what you've said, really. In fact, I remember when we were doing our health coaching courses and we were practicing with each other, I would, as a facilitator, I'd often jump into a room and I'd have to think about something that I was trying to pursue. And for a long time, I was sort of, I would bring up the trying to develop a meditation habit. And I had lots of really good coaching sessions. But I think it was the breaking it down into a small goal. And I think it was one time I was being encouraged to think for myself. And I just sort of thought, you know what, I'm about making too big a thing out of it. And there was two things that really helped me. One was that I knew if I got interrupted, I'd feel a bit stupid. So, I had to find somewhere where I was away from the gazing eye of the children and my wife and so on, because I felt a little bit self-conscious starting it. So I identified a place in the house where I could just hide away, shut myself in this little sort of tiny cupboard room, and no one disturb me. That really worked well. And the other thing was what you said. I started tiny. I decided that even if I only did a 1 minute's worth of meditation, it would be better than nothing. So even if I was super busy, I just go, right, I'm going to my little cupboard just for a minute. That's all I've got today. And actually, I started to really quite enjoy it and see the value of just having some chill time. And then, it just naturally flowed from there. I don't do it every day now, but I'm in the habit often of getting up in the morning and just taking myself off to my little cupboard and doing a little bit of meditation. It's lovely.
Yeah, nice one. I don't know if I've told you, Ollie, that I do freshwater swimming. I don't know if I've
Do
said that.
you? Do you know, I would
Yeah.
never have guessed. It's so rare that people that go cold water swimming talk about it.
So, but I think one of the things that works there is that I do that with other people.
Yeah.
I think if I was going to do that by myself, yeah, especially now when it's dark and it is getting, I don't know if you've noticed, but it's much colder at the moment in the air. There's definitely a nip in the air this weekend and today. Um, yeah, I don't know that I would go if I wasn't going to go with other people. Do you know what I mean? It's a safety thing anyway, I think probably, but
Watch safety
also,
first.
but also, I just think that someone else is going to go, so we do it together, and we're going to do it. We're going to try and do it all the way through the winter. So
You,
and you'll hear about it, Ollie. You'll hear about it.
well, yeah, yeah, whether I like it or not, I hear about it, but it's great. But actually, that, in all honesty, that I mean, there's a lot of science behind cold water swimming, isn't there? So I know how much you love the science, and what's going on there then, Tim? What's going on with the cold
I,
water swimming that's so good for you?
it's freezing cold. I think that's what it is. It's just freezing cold. Yeah.
Well, I think okay, I'm going to add a bit more to it than that because I know the theme of Self-Care Week is mind and body, isn't it? And I think there's been a resurgence in mind body things that people are able to do. We're certainly seeing it in chronic pain, aren't we? And chronic fatigue and for mental health, where the interplay between the mind and body is so important. And cold water swimming, I think, is a great example of where you can use your body to have a really positive effect on your mind. The cold water stimulates dopamine and it stimulates sort of a is it alpha waves in the brain as well, which helps to calm you down and helps with depression, anxiety, mental well-being as a whole. So there is a lot of science behind it, and the sort of the meditation stuff that I was talking about. Again, a great example of how you can use your breathing to relax your mind. Often when I'm meditating, I'll start just with some gentle breathing just to sort of relax me. And I think we're increasingly realizing, aren't we, that some of the mind tricks we can do, sort of in chronic pain. I know there's a sort of real awareness, isn't there, of trying to sort of notice tensions in your body and notice what it's trying to say to you and what meaning you're making out of it. Very often in chronic pain, the meaning you're making out of it is that you're not safe, that there's danger. So helping people to understand that and reframing the way the mind reacts to signals in the body can be incredibly powerful at having a long-term benefit for things like pain and fatigue, can't they? So it's brilliant. The mind and body theme for Self-Care Week, I think, is absolutely spot on.
Yeah, yeah, and I suppose with the pain management, that what's good is the kind of have the top down, which is the kind of the thinking that goes around the kind of feeling, yeah, or reassuring yourself that you're safe, but also the kind of the bottom up, which is kind of doing the things like the breathing and the meditation, which kind of conveys kind of safety to your brain, I suppose.
Yeah, and there's a real science behind it, isn't it? We're using our natural sort of hormonal and nervous systems that will calm us. So, the parasympathetic and the sympathetic, the sympathetic, the flight and fright, which is often activated in people living with pain or with fatigue, often from very good reasons. They've had previous trauma or they're working with a body that's constantly on red alert. And that's keeping you in this kind of like high sensitivity to pain state. The parasympathetic, which is the opposite, which helps you to relax and calm and unwind. So we got these nervous systems there. So things like breathing are a great way of activating the parasympathetic and calming the sympathetic. And there are many other ways that we know to do that as well, aren't there? So we're using our natural, if you like, we're using natural systems in our body to have a positive influence. So we really are using body to influence mind and then mind to influence body and recreate, I guess in chronic pain, you're trying to sort of retain a state where your body's in natural balance. and you can let some of the chronic pain signals go, your mind can calm down and not need the pain signal. So I feel like we're really coming a long way in that mind body science area and applying it to some of the really hard nuts to crack, like chronic pain.
Yeah, yeah, and again, we've done some work with some great people over the years. I'm just thinking about Pete Moore and his
Yeah.
pain toolkit, which is a really helpful for people who are trying to self-manage one of the most well challenging long-term conditions. And he's done some great work there, and he's a great guy, isn't he, to kind of work with?
Yeah, he's brilliant. He got us going, didn't he? Got us going. You boys, you got to get going with the self-care bit. But also I do think of Lee and Narinder and Deepak, who now teach on our pain course, and they are fantastic advocates of this, aren't they? Deepak being kind of probably one of the most prominent consultants in the kind of mind-body approach to pain. Wrote the book, didn't he? The pain-free mindset. And then Lee and Narinder, I think, as two of the kind of leading lived experience um, experts, really. And they've understood what it's like to recover themselves, and they've really become curious about what it was that helped them to do that. And then now have got very good at passing that on to other people. So we're very lucky to have them on our sort of coaching approach to pain management, and then really using the mind body self care approach for chronic pain, aren't we?
Yeah. So I suppose bringing it back to kind of self-care week then,
Mm.
what do you think, what's our ask of people then, as we're kind of bringing this, I suppose we're hoping to bring this to people's attention if they're not if not aware of it at all.
Yeah, well, I think probably building on the theme you started with really is not to hold yourself accountable to something too major. But
Mm.
maybe I would say think about why you want to look after yourself. Is it for you? Is it for people around you? The think about the why, and then maybe just sort of think about one small thing that you can change that feels important to you. Don't make it too big. One small thing, and just start there and see what happens. As BJ Fogg says, success breeds success, doesn't it? So if you achieve your one little small thing, it might just give you encouragement to maybe take things further. How about
Yeah.
you? What's your parting gift for people?
Yeah. Well, I suppose it's just thinking about the kind of the education, the information bit, and I know I've mentioned this before, but I think sometimes in the health and social care sector, we kind of feel like, knowledge is power. Everything people just need knowledge, and so therefore we just download everything we know about a particular topic.
Yeah.
And actually, the reality is that most people are coming to us and they're already kind of up to here. So making sure that the information we provide is in a way that people can easily absorb it rather than just I think Nancy Klein talks about is that component of information is not being told all the relevant facts, it's being able to absorb all the relevant facts. So just bearing in mind that for some people you just need to share a little bit, not maybe everything that you know about self-care, but just what, as I think, I suppose it's coming back to the same thing. It's just a small amount, something small that's going to be useful for that person in that moment.
I think we over egg what we need to do, don't we, as health coaches, and what we need to sort of, if you like, push people to do or see them set goals for. So I love that, the fact that actually, we should be mindful of how much someone can absorb, not how much we think we ought to tell them.
Yeah, yeah. That's just much more succinct way of saying what I just said there, Ollie.
Well,
I'm gonna
thank
make a
you.
note. I'm gonna make a note
It's
of that.
very, very unusual for me to be more succinct than you, Tim. I appreciate that. Yeah. Cool. Well, hey,
Great.
look, I think in the purpose of succinctness, I think let's wrap it up there, shall we? But let's hope everybody has a good self-care week. Do interact with us. Lovely to hear what you're going to do, what your reflections are about our banter. And yeah, do champion self-care this week and every week, really.
Yeah, and maybe in the comments, maybe just put something there that you're doing to look after yourself. Maybe
Yeah,
put that in. I
I
mean, it may be cold water swimming, for instance. It might be that. It might not be. Other things are available, apparently. Yeah.
yeah, yeah. Let's see what happens. I'm gonna come on. Let's finish off with one thing we're gonna do. What we're gonna do for self-care week. I mean, we haven't planned this in any way, have we? In fact, we never plan anything we talk about, do we? Um, What am I going to do for self-care week? I think I'm going to spend a little bit more time reading in the bath.
Okay. Well, I'm slightly inspired actually by your meditation practice,
Oh,
Ollie. So I think I can do that. If I can just, I'm going to start small though,
yeah.
and maybe just kind of, I'm going to say 5 minutes. I'm going to set a timer every day and do 5 minutes of meditation. That's what I'll do.
5 minutes. Do you think you
Is that
can?
is that too
Well,
much?
who knows? Who knows? But don't worry if you don't do as much as 5 minutes. I think as long, there's good evidence actually, even a minute is really beneficial for you. But in terms of establishing a habit, yeah, aim for five. But if you do one, hey, that's pretty good.
Okay. Well, maybe one's going to be more realistic. So maybe I'll start with that and I can build it up then, can't I? As I go.
Absolutely. I'll check it. And you're wondering if I was going to say I'm going to start cold water swimming, weren't you? But
Well, it's not for everyone,
there's
Ollie. It's
limits.
not for everyone.
I'm just not tough enough. I'm nowhere near tough enough. Great,
Good.
lovely chatting to you, mate. Have a
Yeah,
good have
and
a good
you.
self-care week.
Yeah, and you.
Cheers.